we are trying to make sense of all the world's healthcare data.
We're transitioning, becoming less of an IT company, more of a health company. And I think that involves finding ways in which we can help improve healthcare.
If you look at the cost reductions that need to happen in healthcare, most of the spend is occurring in the top 5 chronic conditions. And so the only way that you're really going to drive that cost down is you have to get some perspective on that population. And you have to understand how they behave and how they're motivated. There's a huge amount of data in healthcare, and there are many, many islands.
We started running into these new challenges that our available tools that we had at the time weren't really great fits for some of the challenges.
Hadoop and the surrounding ecosystem is a way to bring all of this data into a common platform and then make sense of it. We are a healthcare company, we're not an infrastructure company, so it's much better for us if we've got a partner that can help us get us away from the infrastructure so that we can go focus on the real problems that we're trying to solve, which is in the healthcare space.
We put together a pretty significant list of criteria that we're looking for. We went through a scoring process, and in the end, we decided to partner with Cloudera.
I think Cloudera is going to be an important partner from our perspective so that we get very good at operating these clusters, because we have quite a big footprint inside of our data center today.
I felt like Cloudera was a little bit closer to some of the philosophy that we had in building simpler, more prescriptive libraries to broaden the audience of Hadoop. And since things like Crunch and Kite, though they're open source projects, were being driven by engineers from Cloudera, I felt like it was a closer alignment in terms of the approaches that we wanted to take.
We're sort of at the inflection point of the hockey stick in which we are now finally realizing all the value of the investment, getting the data aggregated and in a form where we can start reasoning about it and gaining insights in a way that we haven't been able to do in the past.
What's unique about these new systems that we're able to build is that we can bring together data from all of these sources to build that more complete picture, and as a result we're able to yield a much better outcome than we could than just looking at pieces of the puzzle individually.
Population health is really about building applications that help healthcare systems manage the chronic conditions of their populations.
And really that boils down to understanding the nature, the health of the areas of opportunities improvement across a population of millions of people, and then being helped improve care to control costs. One of the patterns that we're using is to actually detect the probability of a person is septic, that they have an infection in the bloodstream. And we have clients reporting that's actually saved hundreds of lives by being able to predict that more effectively.